Hi, my name is Carrie Med, and I am a student with American Sentinel University. And today I'm going to go ahead and provide a capstone project proposal for class 499. I selected skincare of the neonatal infant for two reasons. The first is due to my profession as a NICU nurse and my passion for caring for our smallest and most vulnerable patients. When considering a project for Capstone, I felt it was important to use this opportunity to benefit the patients that I care for every day and focus on an issue that is a constant challenge for us as their healthcare providers and for them. Secondly, our neonatal babies have considerable challenges with skin integrity. The skin of a neonatal infant, it is an amazing organ, amounts to being about 5 times greater than that of an adult. When caring for neonatal infants, they're often less than 1,500 grams and have developed only 2 to 3 layers of their outermost skin tissue, which is called the stratum corneum. Full-term infants, in comparison, have developed 10 to 20 layers at birth. So it's a big difference when you have a baby that might be born 15 weeks early, 10 weeks early. They haven't had time to finish growing this organ that is very important for them. When considering the fact and recognizing that skin is responsible for assisting in thermoregulation, insensible water loss, sensory, and immune system as a primary focus, it's critical to manage how providers are caring for their skin and making sure that they're doing it in the best way possible. Neonatal infants have several risk factors that affect their skin condition that will be reviewed in the project. There are several areas of care for neonates that can be improved upon by better skincare procedures and policies. Additionally, there are several areas that can also be improved upon within the nursing healthcare profession based on this project. There are many ways that this project will directly impact the profession of a NICU nurse. Since as a NICU nurse, these little guys are our focus. Due to the fact that neonates are very sensitive regarding their skin, any change in stress, pain, or injury to skin tissue can have serious consequences. During the neonatal period, many newborns develop preventable, clinically apparent skin problems, and many more, especially preterm neonates, experience morbidity caused by compromised skin barrier integrity. By improving skincare, it will improve our neonates' health outcomes and the care we provide to them based on several things. They include decrease in injury, decrease of risk of infection, decreased incidence of painful stimuli, improved comfort and rest from lack of painful stimuli, and improved quality of health. I think it's important to note at this point that when neonates experience pain or discomfort, that can come from anything, but specifically skin breakdown in this topic, babies don't rest and they can't settle. Babies need rest in order to grow, and they need rest in order to heal. And when you have an infant at that level that's constantly having painful stimuli, for example, from maybe tissue breakdown on their face from skin barrier products that were used maybe incorrectly to hold a nasal cannula or an OG tube, that baby, every time it moves and it feels that, it's waking up, it's stressing, and it's keeping it from adequately or using this to its advantage to rest its best and heal. It's interesting to consider how improving skincare for neonates will impact the profession on a whole. There are several areas of nursing that can be improved upon in both adult skincare with the elderly who have similar skin breakdown challenges, in addition to how we can care for skin in a broader spectrum. Areas that may be impacted include increasing the knowledge to healthcare professionals on the risks of neonatal skincare. NICUs are all over the country. Improved health outcomes for neonates. Potential changes for healthcare team procedures and hospital policies. There possibly is a decrease in costs related to risk factors of skin breakdown. By improving those situations, those costs can be allowed to go towards other initiatives within the facility. and positive parent-provider experiences that improve the patient satisfaction in the NICU for that hospital. That last element, I think it's important to note, between parents and providers of patients in the NICU is something that's often overlooked since the patient's always the focus. In NICU, their parents or their family is also a focus, and it has to be. In this case, by providing better care for neonates and initiating including them on why skincare is important and the various tasks completed to improve the skincare for their baby, it involves the parents and their infant's care. By including parents, they're allowed proximity, which they need for bonding, communicate with them clearly and openly, form a rapport with the nurses, and they become more satisfied and confident in their parenting role and with the care that's provided in the NICU. And eventually that is a reflection of their confidence and experience with the hospital. So I think that that's important to note as well. So I appreciate you watching my video, and I look forward to working on this project.